Health, brought to you by Barber Behavioral Health, a service of Barber National Institute.
And Chris Elliott, VP of Behavioral Health, is joining us now to go on and continue our conversation about suicide prevention. It is National Suicide Prevention Month. Chris, nice to have you.
Yeah, thank you.
Yeah.
It's a hard topic to talk about, but it's an important one.
It is.
So today we're going to talk about kind of the risk factors that go into suicide. The first is, people that have depression, anxiety, schizophrenia, they're more prone to suicide. And people with prolonged stress, so that could be, being bullied. We talked about that before. Financial hardships, loss of loved ones. Those are all things that kind of can start tipping the scale and cause some suicide ideation and suicidal thoughts. So those are things that we kind of want to be on the lookout for.
So when does it go further into what physical signs should we be looking at, or what language should raise some red flags with a friend or a family member?
Yeah, you start noticing some like behavioral changes. They could be nonverbal, just their body language, their mood, or even like their verbal changes. What they start talking about that are just kind of like question marks of like, okay, that kind of caught me off guard, the things that they never would have talked about before. So some of those things can be red flags as well.
When you're seeing some of those red flags, what's the best way to approach it?
So it's a hard thing to do for people that are experiencing themselves, but also their loved ones. And there's a stigma around, trying to reach out for help, right? Whether that's for yourself or for the person that you're caring about. So it's really kind of goes back to some of the basic things we talked about is, if someone's gone through a divorce or a hard loss or something like that, check in on them. The more you can kind of communicate with people, the better they might feel. Feeling isolated after such a tragic event is really those things, again, that start just piling up on people. So checking in, making sure you're available for them, that kind of stuff is really what's important.
Yep.
Yeah, it is a hard thing to talk about, but does talking about it help? Like when September here, Suicide Prevention Month, does that help at all? More awareness about it, more conversation about it?
Yeah, it can be something that just kind of like flips a little switch or a little light bulb goes off that kind of gets them off that path just for that quick second, and that can help them just kind of go down a different road. So talking about it, I think we should share the resources that are out there, the star 988 hotline, and then the Erie County Crisis Line. Those are two things that if you have nowhere else to turn, that's where you can turn.
And 988 can really be used for any mental health crisis,
Correct.
right? It doesn't have to be suicide prevention. If you're feeling at a breaking point with mental health, 988 it can be your resource, as easy as 911.
Correct.
Did you happen to see the video of John Bon Jovi intervening when he was shooting a music video on a bridge in Tennessee, and he saw somebody standing on, just getting ready perhaps to jump, and he approached her with another member of his staff, and they just calmly talked to her and then helped her over. And then it went on to say he has training through his foundation, but you don't necessarily have to have training. You just have to be able to show empathy and care and show love.
Yep, that simple reaching out when people need it. Yep.
Yeah.
Well, Chris Elliott, thanks so much for being here. And we always like to share this number, perhaps a starting point for you, Barber Behavioral Health, all that information there on your screen.
Yeah. Thanks, Chris. Appreciate
Thank
it.
you.
Let's send it back over to